Neuropathy. Now, neuropathy usually shows up on the hands and feet, but it can show up in other places as well. I've seen patients who had it on their trunk or on their face, for example. But most of the time it's in their hands and feet. And then most of the time patients don't know why it started. Sometimes they do, but usually it's what's called idiopathic neuropathy, which means we don't know why it started, but we have it, right? So neuropathy, we break the word down: neuro, nerve, apathy, death. It's the death of the peripheral nerves, is how it's defined in the literal definition. And what happens is it usually presents with numbness in the hands or the feet. And for many patients, it can creep up the arm or up the leg. And in the worst cases I've ever seen, it'll actually, for the legs, go from the feet, up the legs, up to even the belly button. So that is really bad, but it can happen. And that's part of what we're trying to prevent. But Western medicine does not have anything currently to stop the progression of neuropathy. That's why I see so much neuropathy in my clinic, because what we do stops the progression of the neuropathy, reverses the neuropathy, and alleviates the very uncomfortable, painful neuropathy symptoms that people get, which would include things like burning and numbness and feeling like they're walking on thumbtacks or pins and needles. It's going to depend on where they are, what stage of the disease process they're in. In the beginning, it's more painful because the nerves are still alive, but the myelin sheath that wraps around and protects those nerves is being damaged, and that raw nerve is becoming exposed, and that's where we get that like hot burning sensation or that electric shock feeling. And then as it progresses and the nerve continues to die or become dormant, that's when they lose sensation altogether and it feels like their foot is dead. They can't feel it, which is very dangerous, as you can imagine. This is how a lot of car accidents, in fact, happen, where people are pressing the gas or the brake pedal and they don't know which one they're actually touching because they cannot feel their foot. If they cannot feel their foot, they cannot feel the gas pedal or the brake. So that's really bad. Also, they become more of a fall risk and just overall danger. So we do see it a lot with diabetics, but it's not just with diabetics. Sometimes it's with a chronic history issue with the low back, stenosis, pinched nerve, herniated disc in the lower back or mid to low back. Sometimes it is from another type of injury. It could be at the knee. Sometimes after knee replacement surgery, they'll have nerve damage at the knee, for example, and that'll lead to neuropathy in the feet. So there's a couple different ways that they can get neuropathy, but we are outstanding at treating it at the clinic. Over 85% success rate in restoring sensation in the feet while getting rid of any of the discomfort or pain, as well as the hands or anywhere else the neuropathy shows up. So if you would like to learn more, definitely contact us at the office for a consultation. We do an exam first to see what the heck is going on, how bad is it, and then we can determine what the prognosis is and how we can help and what it would look like to fix it. All right, share this today with somebody that you love who might have trouble with their feet or their hands in case it is, in fact, neuropathy.